my name is Pam. Today we're going to be talking about how parasites cause pain in multiple sclerosis and other chronic diseases. And that is right, it's how parasites, not the immune system. We're told that the immune system is attacking our nerves and our tissue, and nothing could be further from the truth. So I'll be sharing lots of new and old and forgotten research linking many different types of parasites to causing pain in multiple sclerosis and other chronic diseases. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed over 35 years ago with multiple sclerosis. By the grace of God and a lot of work on my part, I learned early on that I was dealing with parasites. So I was very, very blessed, fortunate to be able to take a different path early after my diagnosis of multiple sclerosis. And a lot of people are not that lucky to learn about the parasites that cause MS. So they spend years and years suffering with a lot of pain. Let's first talk about some of the common types of pain that we deal with multiple sclerosis. So the symptoms could be trigeminal neuralgia, which is extremely painful. And this is a time where we'll have pain in our, like facial pain in the jaw area. And this can be very sharp stabbing and facial pain. There's also dysesthesia. There will be a few terms that I'm not comfortable saying, but anyhow, so this is basically burning, aching, and also other MS sensations. And there's also optic neuritis. That's what I had when I was diagnosed with multiple sclerosis. I had a terrible case of optic neuritis. I had a complete blackout on my left eye for several days, and I was put on prednisone. And with that came a lot of head pain, like headaches and eye pain, and also loss of vision. There's also this electric shock, and I had that also before I was diagnosed with MS when I was still pregnant with my second child. And so this is where you get this, like if you bend your neck down, you get this shock running down your back, down your back and down the spine. And there's also neuropathy. That's another really common symptom that people deal with, and it's incredibly painful. Restless leg syndrome, maybe some of you have had that. Maybe let me know what kind of symptoms you have dealt with being diagnosed with multiple sclerosis, or it could be some other type of chronic disease. So what kind of pain symptoms have you been dealing with? So again, with multiple sclerosis, pain can feel like burning, tingling, stabbing, aching, itching, cramping, spasms. Muscle spasms are terrible, and stiffness. And so MS pain often gets worse at night. And we know that parasites are more active at night. So it's not surprising to us that multiple sclerosis is an infectious disease caused by parasites, because all of these things make sense when you start to link it to knowing the root cause. And that's what's so exciting, is when people find our work and they go through our work and they're just blown away. They're like, why haven't I heard about this before? This makes so much sense. For the first time, I just couldn't believe that my body was attacking my nerve tissue for no reason. And infections, parasites make so much sense. It's awful that it's not shared with our doctors, that our doctors are not trained in this. But this is the world that we live in right now. And the only way things are going to change is if you help me to bring change. So if you like what I'm sharing with you, please stop for 1 minute and like this and share it with other groups, with other people. It only takes a second, and that is the only way we're going to change the world, is by getting one person to learn about it. The next person, it might be somebody you know that is suffering with a lot of pain. It doesn't have to be just multiple sclerosis, but other conditions also. So again, burning, tingling, stabbing, electric shocks, aching, itching, also resistant to cream. So like you might be using like an antihistamine type cream or something for hives or rashes and it's not going away, cramps, spasms, stiffness. And this pain is often worse at night when the parasites are more active. And also, these symptoms of pain, they can come and go. They're not consistent, and they can be worse and they can be not as bad. And that's another big sign of parasites, how active they are. And that can change dependent on what we're eating, things in our lifestyle. Like maybe we didn't get enough sleep, like when we're really infested. And if we're not getting enough sleep, our immune system will be weaker, and then the parasites will be more active and we'll have more pain. Or maybe we're eating too many grams of carbs, and the parasites love carbohydrates. That's their favorite source of energy. So then our symptoms of pain will be worse. Also, if we're not having daily bowel movements, right? There's so many factors that will affect, like very small adjustments will make all the difference in our pain level when we're dealing with multiple sclerosis pain or other pain. What's really interesting is that at least 2/3 of people diagnosed with multiple sclerosis report pain. The most common pain would be headaches, about 43%, and then limb pain would be about 26%, back pain 20%, that hug, the MS hug, about 16%, and trigeminal neuralgia about 4%. And that's probably the worst pain, is the trigeminal neuralgia. I haven't had it before, but with the students I work with, very small numbers have it, but it's brutally awful pain. And so MS and other people that are suffering with other chronic diseases, they can experience moderate to severe pain. Some of them might take pain medications, which may or may not help. Also, sometimes if you are reliant on pain medications, they can actually make the pain worse. This is a syndrome that I've heard about several times before, that actually if you're on pain medication for years and years, that it can actually amplify the pain, which is so counterintuitive, which is awful. And of course, pain really decreases our quality of life, right? Because we're suffering. You just can't get away from it, whether it's back pain, whether it's muscle spasms. It just goes on and on. You can have even bladder issues and kidney or bladder pain. It can affect many different type areas of the body. A 2021 study showed that sleep problems and pain can appear up to 5 years before a person gets an MS diagnosis. We also know the gut issues too, right? All the digestive issues can happen at least 5 years before a person gets a MS diagnosis. And then the standard of theory, or the standard theory that we have with multiple sclerosis, and this has not been proven. So a theory is something that has not been proven, that MS is an autoimmune disease caused by our immune system attacking our nerve tissue for some unknown reason, for no apparent reason, they say. They don't know why. And this is a theory, right? So we've been running all these years on theory. We're not figuring anything out. We're not even trying to figure anything out anymore. We're literally just looking for new drugs, new maintenance drugs to manage the pain that we're living with. And that's not acceptable for us that have multiple sclerosis or other diseases. We don't want to live with a pain, with a disability. We want to recover. So this is not acceptable. I'm speaking for myself, and I'm sure, tell me if you feel this is acceptable, that we're stuck in this gridlock of, oh, we're just looking for new disease-modifying immunosuppressive drugs because the immune system is attacking itself for no reason. This theory is dead. This theory is old. This theory needs to be thrown in the garbage, and we need to go to work. There's so much evidence that multiple sclerosis is an infectious disease. Some of this evidence is over 100 years old. What happened? Why do we not care about that research anymore, right? We know that MS, all diseases, they are inflammatory conditions. We know that inflammation is the immune system's response to an invader of some kind. The primary job of our immune system is to fight infection. So why are we not researching which infections are causing multiple sclerosis, which parasites are causing MS? So to me, a parasite is any microbe that lives in your body and causes you harm. This can be worms, protozoa, fungi, and bacteria. So this unproven theory is really keeping us sick or stuck and sick. We're not moving forward. We're not looking for a cure. And this theory has not been proven, and it really does not explain the wide range of symptoms that we experience. Also, the unpredictability of the pain, for example, like how sometimes we'll have lots of pain and we'll have less pain and we'll have more at night, and it moves around the body, and the pain patterns. So all of this theory does not explain it, because if your immune system is just attacking your nerve tissue, then why does it do it sometimes? And it doesn't do it more at night and not as much during the day. And you'll go through periods where you don't have as much pain. So why does that all fluctuate? It's too easy of a cop-out to basically just say, oh, MS is an autoimmune disease, end of story. No, it's not the end of the story for us. So the real cause of multiple sclerosis and all chronic diseases are parasites. So infections, chronic infections in the body that our healthcare professionals and our science, like we just don't have good tests, and our practitioners are not equipped, skilled to recognize these parasites or to treat them. So they don't have experience with the parasite drugs or herbs, oxygen therapies. They don't know anything about it, because they really believe that we don't have parasites in developed countries, and nothing could be further from the truth. Otherwise, the government says there are parasites in our soil, there's parasites on our food, there's parasites in our pet. Our veterinarians know that we should be deworming our pets regularly. So parasites are part of life, and we have to learn how to not just let them take over our body, but to manage them, to keep their population down in our body, because then we live a much longer, healthier, happier life. So some different parasites, I'm just going to run through a few here. So just let me know what kind of pain that you're dealing with from these parasites. So whether it's like headaches, or maybe it's trigeminal neuralgia, or maybe it's muscle spasms. Somebody put drop foot here. But what kind of back pain? Back pain is another symptom of parasites. So there's many symptoms. We get bladder pain, muscle pain, pain and headaches. It just pretty much endless. So trigeminal neuralgia is really sharp facial pain, and it's associated with tapeworms. So remember, I've done a talk about neurocysticercosis, which is when the tapeworm larvae get into the central nervous system, and they produce these little sacs, bladders of the larva, and they cause a lot of neurological symptoms. Dr. Alan McDonald found these tapeworm larvae in the central nervous system of every MS subject he looked at. So, and it's not commonly known that the tapeworm larva can cause trigeminal neuralgia, but the cases are there in science that they have found that people that had trigeminal neuralgia, case reports that they actually had tapeworm larvae. So they're not looking for it, unfortunately. So how often is that the case when we know that Dr. Alan McDonald found tapeworm larvae in every single brain of MS, 10 out of 10 that he looked at? Mycoplasma pneumoniae. So this is a type of bacteria that is also linked with or has been connected with trigeminal neuralgia. And then also a malaria protozoa. It can cause face palsy and trigeminal neuralgia. And then also another protozoa, which is toxoplasma, and that can also have the same type of, cranial nerve inflammation and trigeminal neuralgia. So there are multiple different types of parasites that can cause all of these pain syndromes that we're dealing with. So it's probably not going to be the big worms in our gut. Yes, they could be linked, but it's usually the protozoa and bacteria that are much smaller that can get into the central nervous system easier. And then also the larva of the worms. So the larva of the worms, the immature form of the worms, and also the protozoa, which are single-celled parasites, and also bacteria. So fungi can also, but we're not seeing huge shifts in improvements in neurological symptoms with treating fungus. It's a good idea to treat fungus. Fungus can produce a lot of mycotoxins that are terrible, but we do treat it in every cycle as we are recovering from these parasites, because pretty much everyone has fungal overgrowth. But when people are taking the fungal medications, they're really not noticing like huge shifts and decreased pain. They do notice a huge improvement in pain with the Live Disease-Free diet. So make sure that if you want to see if that works for you, go onto our website, livediseasefree.com. Under research, you will find the Live Disease-Free guidelines for free. There's a cheat sheet you can print off and put in your kitchen and go really low carb. Check the total grams of carbs you're eating by going on the Chronometer app, and there you can track your total grams of carbs, and you want to get down to about 30 to 40 total grams of carbs. The closer you are to 30, you can notice a lot more decrease in various types of pain. So with just trigeminal neuralgia, we're seeing that tapeworm can be present, can be causing this. And so sometimes it's actually the larva, or sometimes it's the cysts that these parasites are producing. But then also I've shown you research, and I'll put all of this in a blog post like I do every week for you on our website, livediseasefree.com. By Friday or Monday, there will be an article written with links to all of the studies. So if you want to look at the case reports of people that have had these different types of parasites, and it was linked to a specific type of pain. But just know that if you have trigeminal neuralgia, there could be several different types, and ones that I have not even included here, that can cause it. It is definitely an infection. The nice thing is there's really only 4 categories of different types of parasites, like bacteria, fungi, protozoa, and worms. So it's not like we have infinite numbers of different types of parasites. So that helps with treatment and recovery. But the key is that it could be other ones that I haven't even listed here. But this shows you that there are, even though the doctors are not, like if you get trigeminal neuralgia, the doctors are not looking for parasites. But there are some very forward-thinking researchers, practitioners that have found case reports where they have linked the trigeminal neuralgia to a certain parasite, and they've treated it, and the person has recovered. So that is the key. The key is to just start to question and start to talk to your practitioner about, like, why is this not being studied? That is the really awful thing. So if we have burning, that can really be linked with, like burning nerves, that can be linked with schistosoma species. So that would be flukes. Those are flatworms. They're shorter, they're wider, they're very pro-inflammatory. They can cause all kinds of symptoms. And so they can cause also bladder dysfunction. They can really establish themselves in the bladder and cause bladder pain, urgency, frequent urinary tract infections, but also like the MS, hug, and burning. And I did not know, but the flukes are so much more common even in the developed countries that I didn't know. Like, we live in British Columbia, Canada. We have lots of lakes, and we go swimming in the summer, and that at certain beaches you have to stay away because there's swimmer's itch from the ducks or the geese that are there. I think it's the ducks. And I thought it was a bacterial infection until just recently I started researching, and I found out that is the fluke, that is the blood fluke. And my son had a terrible case of it when he was younger. And even one of our dogs got a terrible case of the swimmer's itch, like the welts. Like, my son had huge welts on his leg. Like, I think he had to get medicine, like go to the doctor and get medicine. I don't know if they treated him for schistosomiasis. That was a very long time ago. But this is where we need to really pay attention. If we've had that strong of a case of swimmer's itch, then by the time we are an adult and we're getting middle-aged, if we start noticing that we have bladder issues or other symptoms of schistosoma, then we really need to look into it, because yes, our immune system should try to get rid of the larva that's trying to work its way through our skin into our blood, but sometimes it doesn't get all of them, and maybe a few or one or two get through. And maybe when we're younger, our immune system kind of is stronger and it's putting up with them. But as we get older, then our immune system doesn't deal with them as well. And then they become more of a overpopulated problem. So they're really linked with like the MS, hug, and burning. Optic neuritis, there's so many different types of parasites that can be causing optic neuritis. So toxoplasma, which is a protozoa, single cell parasite. And then there is another nematode. It's Angiostrongylius strongylius, and that is a nematode. Toxocara is another one. That's a roundworm. And also the flatworm, the tapeworm, for sure also. So that's 1, 2, 3, 4. And then also river blindness caused by a nematode. That is another one. So there's 1, 2, 3, 4, at least 1, 2, 3, 4, 5 different parasites that I have just shared with you that are linked with causing optic neuritis. And that is very common in multiple sclerosis. So this would include protozoa, single cell parasites, also roundworms and tapeworms. I didn't list a bacteria, but enough of the other parasites. And then remember the electric shock that runs down the spine when we have multiple sclerosis. That has been linked in research with the tapeworm. Also neuropathy. This is where you have a lot of burning in pain in your limbs. So this can be linked with being caused by the tapeworm and also protozoa. So the tapeworm is a flatworm. And then toxoplasma is a protozoa, and plasmodium, which is the parasite that causes malaria, that is a single cell parasite. Schistosoma, which is a fluke, that's a trematode, it's a fluke. And also another different types of flatworm, tapeworm. There's different species of different tapeworms. And then another nematode, trigeminal. That's another one. And then I can't say this word, just a second. I'm just going to split it up a little bit here. That helps a lot. Okay, so Angiostrongylius, something like that. Anyhow, so that is a nematode. I just don't say these words all the time, so they're a little bit of a tongue twister. So there you have 1, 2, 3, 4, 5, 6, 7, 8 different parasites that can cause neuropathy in the body of human beings, right? And that's a really common symptom in multiple sclerosis also. And then restless leg syndrome. Please just type in the question box, like, do you suffer with any of these types of pain syndromes with multiple sclerosis or maybe another disease? So restless leg syndrome, neuropathy, optic neuritis we talked about, and then the MS hug and trigeminal neuralgia. And we haven't even covered everything. Maybe you've suffered with drop foot, spasticity. Like we've talked about even the small filarial worms that Dr. Alan McDonald found in MS subjects, in every MS subject. They're linked with many of these, like even spasticity. So there's so much more we could cover in this topic. All right, so let's talk about restless leg syndrome. So hookworms, they can definitely be involved in causing restless leg syndrome. So sometimes these parasites directly cause the pain, and sometimes they cause it indirectly. So they might cause, like they might produce a toxin, or they might produce like cysts, or like somehow they're causing inflammation. So the hookworm cause is linked with like chronic iron loss, so chronic iron anemia, and that can be involved with restless leg syndrome. And then headaches and multiple sclerosis. This was the greatest pain, the cause of pain in MS patients in a study that was done. And these parasites are known to cause headaches by invading brain tissue and increasing pressure in the brain. So there again, there's the tapeworm, so that's a cestode, and then there is a protozoa called toxoplasma, and then another protozoa called trypanosoma, and another protozoa, which is plasmodium, like that's the parasite that is linked with or is causing malaria, and then a different type of tapeworm, and then another type of nematode. So here we have tapeworms, protozoa, and nematodes linked 1, 2, 3, 4, 5, 6, linked to headaches. And I'm sure that there are more that are causing headaches. But this is just literally me taking an hour and scouring the research and just kind of pulling a few different resources. And I'll put this together on a blog post. And I don't know, hopefully I'll have time. I will be creating more and more resources for you. So I did about 2 weeks ago, 3 weeks ago possibly, I created a PDF for you, a one-page PDF. It's on a blog post. So it was not last week's where we talked about the wellness champion successes. That was really fun. But it was the week before, how to talk to your doctor about parasites. So there is a link there to a PDF, one pager that you can print off and hand to your doctor. Then you can, if you can get his permission or her permission to send them the link so that they can actually click and go into the research more. But this is how you can help me to get the word out. Like, we have to make this happen. There are things happening in the world right now that are not very good. And if we don't get ahead of this, like even with this, programmable currency that's coming, it's going to be really hard. I suspect it will be harder to treat parasites in certain countries, like where I live. It already is really difficult to treat parasites. They have a lot of control over this. They do not want the powers that be do not want us to be treating parasites because that would destroy a multi-trillion-dollar industry. So we really have to get this to practitioners, so to doctors, to chiropractors. Actually, one of the students on my call that I work with, like a lot of students that are recovering, that are following the Live Disease-Free plan, he said that his chiropractor said that the chiropractors in his area are really buzzing with talking about parasites like crazy. So that is exciting. They're starting to get it, but you have to give them, like, they don't have much time. And if I've created this for you, you can give this to them, right? And so I should make up a page showing like all these different parasites too that cause pain, because pain is a really big part of MS. And so one thing that you can do to alleviate some of your pain is to follow the Live Disease-Free diet, decrease your carbs significantly, because you'll find the parasites will be less active. They produce less poisons. The immune system works a lot less. And we've had people that their pain went to almost zero just with diet alone. The parasites are still there. And if you eat a lot of sugar, you're going to flare them up like putting gas on a fire. But if you decrease your carbs tremendously, and you're not going to starve, you can still have lots of good food. You'll feel very satisfied, but it's crazy how much the pain can go down, whether it's spasticity, whether it's headaches, whether it's bladder issues, whether it's like the drop foot usually takes a little longer to improve, but neuropathy can really decrease significantly. So all of these pain syndromes that we're dealing with, MS, the MS hug, they can all significantly decrease just with diet. And the reason is the Live Disease-Free diet is low carb, and we know that parasites, their favorite source of energy is carbohydrates and simple sugars. All right, so the takeaway is that pain in multiple sclerosis is real, but it is not caused by an autoimmune response. The immune system is not attacking our nerve tissue and for no reason. It is attacking infection, and there's a war going on, and sometimes there's damage, and the damage can be inflamed nerves, and that is what's causing the pain. So by suppressing our soldiers, by suppressing our natural defense, that makes us even weaker, and that makes us more disabled more quickly in time. That is my humble opinion. We need our immune system. We need our immune cells, because the adverse effect of a lot of these the adverse effects of a lot of these immunosuppressive drugs, the maintenance drugs, is cancer. And that is what's worse, cancer or multiple sclerosis. They're both absolutely horrible. So we don't want to suppress our immune system. And the parasites and the chronic infections are our immune system's response to them. That is what's causing this inflammation and pain. And recovery is possible if we treat the root cause, if we treat the parasites that are causing the immune response, which causes the pain, because that's the inflammation. The inflammation is causing the pain. So what I'd love for you to do, I'm just going to go through your questions for a few moments here. And I would like you to think about, like, if all of these parasites that I've shared with you can cause all of these pain syndromes that we're dealing with in multiple sclerosis and other chronic diseases, then why are they never finding even one parasite? They're not looking for them. And that's the whole key. Somebody emailed our company today and they're like, well, like when they take your spinal fluid, why don't they see the worms? Because they're not looking. They're looking for antibodies. They're looking for certain proteins, and they just chuck the rest out. It's as bad when our students are getting a stool test done. We don't recommend it, but if they get one done, and they'll put their parasites that they've passed in their stool, and then they get the result back, and it's like, you don't have any parasites. And it's like, well, I actually put a big fat worm in there, and you said I don't have parasites? Like, that's how bad it is. It is so incredibly, ridiculously bad. It just blows your mind. And so, you're going to have to come to a place where you decide, like, am I going to keep following this dead end, this go nowhere, become disabled in time, suffer with pain, suffer with disability? Or am I going to get to the place where Pam has presented so much overwhelming evidence, both in science and in people recovering, that I cannot afford to wait? I cannot afford to wait for the decades of the battle that's going on to try to save our healthcare system. I want my life back this year. I want to be fully living my life. I want to get as much recovery as possible. It will be more than you ever thought possible, even if you're very disabled, because that's what we're seeing in our students. But you have to do the right things. These parasites are really challenging to treat. If it was that simple, I would write a book, but it's not. And it's not always the same parasites in MS patients. It's sometimes various. It's like where the parasites are located, not necessarily which parasites you have. So there are some common ones, but our students don't all have a cookie cutter treatment plan. I wish they did. That would make life a lot easier. But think about it like your yard. If you don't take care of your yard, the weeds move in. And you're not just going to get dandelions. Yeah, you'll get a lot of dandelions, but there will be thistles, and there will be all kinds of different types of weeds, noxious weeds. And you can't just treat one weed and expect to have a beautiful yard. You have to get rid of various different types of weeds. So that is the key, is that it's not just one type of parasite that is causing the pain. There's various types of parasites. All right. So Ace, you deal with drop foot, which is awful, painful. And yes, and Ross, you also said drop foot. And Sashel, no pain syndrome, drop feet, and then no movement in leg. Help, or how can I help myself? So this is where you have to make the decision. Research. Like, I have an amazing website, livediseasefree.com. Go to our blog post there. I have articles every week. I'm sharing research. You can see all the worm pictures our students are passing. You can see pictures of flukes, of roundworms. And You might not want to look at them, but you probably should, because that's part of the problem. It's a very big part of the problem. So start to learn and start to really understand what you're dealing with. And then if you don't have a practitioner that can help you, then make sure to reach out, watch my masterclass training. There I share all the steps to recover, and then you can book a time with me if you feel you might want to work with me, but you have questions. And so we have a Live Disease-Free plan, and there's a lot of students that have taken it. So you have to decide if you are going to continue to live in agony or if you're going to treat the root cause and get on with your life. I would encourage you to do that. And even with the Live Disease-Free plan, it is the most cost-effective way to recover. We do not recommend a lot of testing. We do not recommend a lot of supplements. It's like, get ready to treat these parasites as quickly as possible, because they are causing all of your symptoms. Jessica, you had optic neuritis when you were first diagnosed. That was me too. Of course, I always do things, all the way. So I had such a bad case of optic neuritis that it was like this for at least 3 days. And I didn't know what was going on. I had never been sick. And here I am dealing with, complete blackout. I thought the doctors could fix me. I was very naive. I was 28 years old, and found out that no, they can't fix me. And I had a lot of damage in this eye from that severe case of optic neuritis. So this eye is damaged. I cannot drive with it. It's very dark in the center and light around the outside edge. But had I known what I know now, if I could have found somebody that had the knowledge that we have now, I could have turned it around so quickly. I could have saved my vision, but I did not know. I had no idea. But by the grace of God, I learned how to stop any more future disability or symptoms. So I have been able to live MS free now for 35 years. It would have been nice to have full vision too, but unfortunately that's not the case. So, Anna, I have a headache once in a while, backache. I have urine often. What kind of parasites would I have? It's really hard to know. So we know that schistosomiasis, the blood fluke, it really likes to inhabit the kidneys. And so it can really affect our bladder and our urine. But what we see, if you have multiple sclerosis, we often have a lot of roundworms. But we can, again, Dr. Alan McDonald found roundworms, very small ones in the central nervous system, but our students are also passing really big roundworms. And then tapeworms, he found the immature forms in the central nervous system. For my students, quite a number of them are passing flukes, including myself. I passed a lot of flukes that were about 3 inches to 4 inches long, and they're about 1 centimeter wide, so they're flat and they're disgusting. And you'll see pictures of them. I have our students have sent a lot of pictures, and myself, so they're all on the Fluke resource page under. So you can just do a Google search of livediseasefree.com and flukes, and you'll find some pages there one possibly two, where you can look at pictures of roundworms, flukes, and I don't really think I have one for tapeworms yet. So Anna, again, it's like a weedy lawn. What kind of weeds do you have? Probably a few different types. So you'll be dealing with definitely different types of parasites that you have to treat. But we do it in cycles. So we'll treat the larger worms for 10 to 14 days and the protozoa. Then we'll treat fungi for about 10 days. Then we'll take a break week. And during the break week, that's where we'll still use an oxygen therapy. We'll use herbs. We'll still keep the pressure on, but we're kind of treating more of the smaller ones. Maybe if we're more like dealing with Lyme disease, we'll use those kind of treatments, versus if you've had more of a candida or mold history, then you'll use herbs that are geared more towards fungi. So Barry, you were dealing with restless legs, and people that don't have MS, they have restless legs too, right? So, and people that don't have multiple sclerosis, they can get they can get headaches, they can get muscle spasms, they can get restless legs, they can have neuropathy. So it's not, that's the thing, is that they try to say like, oh, when you have MS, you have MS, and it's very distinct. But people that have all kinds of other chronic diseases, they have many of the same symptoms that we have. And so they're, well, no, it's different. It's different because of the lesions. And it's like, well, some people over 50 have lesions in their central nervous system, people that have Crohn's disease or autism. So there's a lot of different people that have migraines, they have lesions. So all these different people have lesions, and they're like, well, no, it's lesions in a certain place in the brain. It's like, well, a few years ago, you said that it was only in these areas of the brain that lesions would be considered for MS. But then over the years, you keep changing it. Why? Right? And it's just so out of control. Like, I don't know if you guys are as fired up about this as I am, but I'm just so sick of it. It's just really sad. And it has to change, and I can't do it by myself. And I really hope you guys help me to get the word out. So with what I'm sharing, like when I make a blog post, you can share it with different groups. You can share it with doctors. When I make these one-pager references with all the science on it and just really concise for practitioners, I hope that you share that. Get them thinking. You know, at first they might dismiss it, but over time, if they keep hearing it over and over and over again, if they're a good practitioner, they are going to go, you know, that's the fourth person or fifth person this week that's talked to me about this. Maybe I should look into it. Hi, Jessica. You said you're planning to tell your doctor next month you're done on medication. Good for you. I'm so proud of you. Again, I can't give medical advice, but research the drugs you're on. And if you see that they're just destroying your immune system and you feel you need your immune system, then talk to your doctor about it. You don't have to take the medications. You are in charge of your health and your body. Thank you, Kev. Really appreciate it. So Lou, you've been diagnosed with Lyme disease for 55 years and you've had MS for 35 years. So you're right that parasites can cause MS. You're very, very welcome. So with my students that have Lyme disease, but they were not diagnosed with multiple sclerosis, they've worked with Lyme literate doctors for years before they found us. They were on lots of antibiotics, and it might have helped a tiny bit at the start, but it didn't really help. And they joined our program. They are passing some of the biggest worms, like up to, for sure, over 2 feet, 2 to 3 foot worms, like tons of them. So we have to rethink everything. I had this really sweet naturopath from the United States somewhere reach out to me and say, Pam, we're writing a book on how multiple sclerosis is, like, people are misdiagnosed. They're diagnosed with multiple sclerosis, but it's actually Lyme disease. And then I said to her, I said, well, actually, you know, probably a lot of people that have multiple sclerosis, they do have Lyme disease, but they have a lot of other parasites too. And she's like, oh, really? And so we talked about it, and she was blown away. And herself, she has been recovering from Lyme disease and like treating Lyme disease, and she's not totally well. And I said, you need to treat other parasites too, not just Borrelia and the co-infections of Lyme, because like most of us have been exposed to Lyme through even mosquitoes. It doesn't have to be a tick. It can be any vector, any biting insect. And so why is it that if pretty much all of us have been exposed to Borrelia, then why is it that 25-30% of people have Lyme disease? It's because our microbiome is so out of balance and our immune system is taxed. And then these Borrelia, et cetera, can be a problem when they should not have been a problem. So if you focus on Lyme disease, treating it, and you don't treat the other larger parasites, you'll never clear the Lyme, right? That's the key, is you got to treat big to small over multiple cycles. And I make it sound easy. It's not super easy, because there are literally thousands of different types of parasites that can cause problems. Okay, a couple more questions. Joseph, what do you recommend for a parasite detox? So our students first follow the diet, go really low carb. You can find that on our website under research, the Live Disease-Free Diet Guidelines. They support the body. They're having daily bowel movements. They're sleeping at night. They look at their blood work. They support their physiology. They clean up their environment. So, and they're doing more things. So they're feeling a lot better before they start treating. Then they are getting energy tested to see which parasite drugs test well for them. And they're going to use a combination of parasite drugs, herbs, antimicrobial herbs, and an oxidizing agent, so an oxygen type therapy that I can't say the name of here, but I've done videos on it, treating parasites with oxygen, something like that. You can look it up and you can find it there. But again, it would be on our website, on our blog posts. So it takes going over cycles and treating big to small, and usually our students test well for 3 to 5 parasite drugs at one time. So that's the key, is that these parasites can lay hundreds, if not thousands, of eggs in a day. They're in a very warm, moist area with lots of nutrition, lots of food. They don't want to leave. And so they also have many ways that they make themselves blind to our immune system until they start dying, and then our immune system recognizes them. So it does take strategy to recover, to even get them out. But it is possible. It does take work. It takes diligence and persistence, but it is life-changing. And then once you're well, once you've knocked the parasites back far enough that you feel that you have the quality of life that you want, then you have to manage that for the rest of your life. So then treat maybe every 6 months or once a year, because you will still be exposed to parasites, just like we treat our pets or animals. Hi, Fawn. Awesome. Prayers, the true cause of chronic illness, will be recognized and treated by doctors ASAP. Yes, that's what my hope and my prayer is. So Tammy, my daughter has multiple sclerosis. I'm praying she will listen to me and she will take to heart what I'm trying to tell her. Thank you for all that you provided. We aren't exempt from parasites being in the animal kingdom. Absolutely. And Marty, you've been experiencing left side electric shocks. I'm sorry to hear that. You've got to treat the parasites that are causing that. Please do. You don't have to live with this. You don't, but you have to take a different path. What do you think of turpentine protocols, Pam, in conjunction with enemas? I actually bought turpentine a lot. I've tried just about everything. I've got zappers and turpentine and all kinds of different gadgets and gadgets. And I really like the idea of turpentine, but it is not near effective enough for what we're dealing with. If you're a super healthy person, you might want to try to decrease a little bit of burden of parasites. Turpentine and the herbs can be helpful, but it's not going to be enough to treat the big worms in the intestines, but also the parasites that have moved into your blood, into your tissue, into your central nervous system. So no, this is the thing with my students, is that I'm very conscious about what they're spending their money on. And so if something isn't really going to give them the biggest bang for their buck, I don't even recommend it. You know, if they want to try it, they can. Even things like Mimosa pudica, I mean, you can use it. We just haven't found it to be super helpful, like pumpkin seeds too. No, there are so many things that they say are really good. Diatomaceous earth, I mean, a person could use that short term, but again, it's not really moving the needle. So we kind of have a really proven plan that works well. And those other kind of things you could use, like once you're well, to kind of manage smaller ones, like the larva or immature forms or things in the gut. But when you're dealing with chronic disease, you need a lot more than that. So Ace, has anyone gone through your program and left before completing it? If so, any reason why? I think that the only reason that a person has gone through my program, I mean, it's really, really rare. I know that there was like one person that started the program and was a vegan before and just can't eat meat. And I personally, I really don't have an issue. If somebody wants to eat a vegan diet, they can. But I personally can't work with them because I just know that the parasites love carbohydrates and I can't stand to see them suffer. So I think that would be about it. It would be more like sometimes it takes people longer to actually treat. So some people have a lot of support. Other people don't. Some people are super disabled. So some people, it takes them a lot longer to even get to treating. And that is the unfortunate thing of the world we live in right now, is that, you know, like you could have somebody who's very disabled in a wheelchair and their whole family just believes in the MS drugs. So they don't have, their family love them, right? And they just feel that that's the best for them, but they know that themselves, they know that that is not the best for them. And so they're just kind of going on their own, and they're confined to a wheelchair, and they really struggle with the parasite drugs, and they can't do the enemas that we do. So for them, it's taking them a lot longer. It can, but every single person is different. I have some people that were in a scooter and literally in 3 months starting to walk with crutches. So it's really the person. This is not about me, right? This is about parasites are causing disease, and there are 4 categories of parasites, and we know that just herbs alone are not enough. And actually, I listened to another doctor, she's treating veterans, US veterans, and she said that everybody has parasites. And she said, herbs will not just do it for you on their own. And that's what we've experienced too. So could somebody not be successful if they don't implement? But the people that usually are attracted to my program, they're really committed and they get it. Like they're the kind of people that they research like crazy. They've looked at all my work. I've got over 100 videos. So they really believe in their heart. They've talked to different doctors and different integrated practitioners, and they go with our program because it's the most step-by-step, systematic, proven system. Instead of just, you know, taking some herbs, you're not going to get the same results. Thanks for the question, Ace. And then Joseph, just a couple more questions here. You lost feeling in your right side of your hand and your foot, and you have pins and needles feeling all the time, and you have urine issues and back pain. So what I can share with you, Joseph, is that our students are so infested with parasites, and not all of them are infested with large ones. They have some, but a lot of them are really infested with large worms. And so this is where I always think oh, is it the protozoa that's causing more of the MS? And then I had one student who, I won't say his name, but he's just he's been treating with, I think, 2 or 3 parasite drugs. He's been doing the enemas. Of course, he prepared before, and then he's been treating. I think it's a 2nd or 3rd treatment cycle. And it's just he just feels like we've saved his life. He's been doing colonics too. So the hydrotherapist has allowed him to put the oxygen solution in the water. And he's been sending me pictures of what he's passing with the colonics and with also his enemas at home. And it's just saving his life. It's affected, his speech is improved back to normal, balance. And I'm trying to think, there's a lot of students. We just had our call, and I'll have to keep sharing, but every week I get these amazing successes. But no more spasms. He's sleeping really well at night. And he's just this has literally saved my life. Right? Because he was getting to the point where he wasn't going to be able to work pretty soon. So pretty exciting. But it's just amazing how infested they are. All right. And then there are a few more questions. I'll answer one more, and just go ahead and type your questions in the question box. We will answer your questions. And what I would really encourage you to do is watch my masterclass training if you want to learn more about the plan, about how we recover. I share everything. I mean, the only thing that I can't share is your specific plan, because I don't know you and I don't know what parasites you've been exposed to, but all the steps to get ready, how we get tested to see which ones are most helpful for us, and basically which kind of parasite drugs there are. So all of that, I share everything with you, but just the treatment part, I have to be responsible so people don't hurt themselves, because I have no idea what medications a person's on, what their health conditions are, what they energy test well for. They're not ready to treat. Our students would never ever start just treating right away, because they could feel really awful. You want to be feeling better, not feeling worse. So you're 53 years old and you broke your ankle and you tore your ligaments. You're also diagnosed with Lyme in July 2024. you're currently going through the process of MS diagnosis, your brain is not working. So I am so sorry to hear that you're going through all of this. So please watch my masterclass training, and just start to, like, my website, livediseasefree.com, will give you tons of hope. You can, and also go to Live Disease Free on YouTube. There is a playlist of successes of our students, so you can go and hear it from their voices, their experience. And then if you decide that you want to take a different path, that you don't want an MS diagnosis, you just want to recover, then watch my masterclass training so you see all the steps we take. You hear case studies of people that have recovered. And then from there, you can book a time to chat with me to make sure it's a good fit for you. So there are people that find me and they are in the process of getting a diagnosis for something, and probably MS, but they're like, I don't want an MS diagnosis. I don't want to be pressured into taking their drugs. I don't believe in that. I don't want to live with this. I don't want that. And then they just treat, and then they get on with their life, and they never have a diagnosis. So that's kind of a nice way to go. It's better, the earlier you treat, the more recovery you will have, and the quicker you can recover. It's still going to be work, but it's a lot less work than living with this horrible disease. So I'm going to let you guys go. I really hope that you enjoyed what I shared with you. I hope this gives you hope that if you are suffering with a lot of pain, and there's many different types of pain in multiple sclerosis and other diseases, so this is not just an MS thing. It is caused by parasites. It is caused by the inflammation, the immune system's response to the parasitic infestation that we're dealing with. And the only way to really recover from that is to treat the root cause, to treat the parasites. So I will be creating a blog post on livediseasefree.com where I will share all my notes, and I will share like a condensed version of the video and all of my notes. So please make sure to share that and like this video and share it and subscribe if you enjoy what I'm sharing with you. You can help me get the word out by sharing this. That is what you can do. And we need change. We have to bring change. We can't let this go on for another generation, because people are getting sicker and sicker, and we do not want others to suffer like we did. So with that, I hope you have a wonderful week, and we will talk to you next week. Take care and bye-bye for now.